So there's several types of bone grafts that we actually do here at High Plains Periodontics and Implant Dentistry. Sometimes we lost a tooth, and if there's a hole right then and there, we use a bone graft to help fill that hole, set up a new foundation, let that to heal, and after a few months we can come back and replace it with a dental implant. Other times the sinuses are held up by bone and the roots, and when you lose a tooth, it's kind of like removing the tint pole off of a tint, and that tint has collapsed and there's not enough bone to place a dental implant. So sometimes we'll have to go into your sinus and add some bone. Sometimes it could be done at the same time. Sometimes it's a procedure we have to do prior, but it's a procedure that we do quite a bit here. The other procedure is like, I lost this tooth, doc, 10 years ago, 15 years ago. I don't even remember the last time I had this tooth. And one of the big things that we notice is over time, bone will atrophy, and that's just fancy words for saying it will start to the volume will start to decrease. Very similar to our cotton fields around here. There's no roots in the ground. When the wind blows, that dirt's going somewhere else. So when there's no tooth root there to help maintain the bone, that bone's going to start to disappear somewhere else. And so sometimes we need to do what we call a ridge augmentation, where we're actually going to try to grow the bone. We're going to import dirt to kind of give us a good field, to give us a great opportunity to place a dental implant to restore that functionality that you lost.